Our next speaker is Dr. Samah Fodeh, Associate Professor in the Department of Emergency Medicine at Yale University School of Medicine and Yale School of Public Health. She's a leading researcher at the intersection of AI and healthcare. Dr. Jarad serves as principal investigator on multiple federally funded projects that advance patient-centered outcome through cutting-edge computational sciences. Her NIH NCI-funded project focuses on quantifying patient-provider communication and examining its impact on outcome for individuals with metastatic cancer. In parallel, her PCORI-funded study leverages machine learning to mine the patient's voice with the goal of improving methods for patient-centered outcome research. She's also the co-PI on the NIH-funded Commons Fund Bridge to AI program, a landmark initiative designed to accelerate discovery and address challenges of medical problems go through the application of AI. Across these efforts, Dr. Jarad integrates computational techniques with deep clinical insight to improve understanding of patient experiences and inform patient-centered information. Beyond her research portfolio, she served as editor, editorial board member on many prestigious AI-centered journals. I won't go through them. All bios of our speaker are on the WiDS website, so feel free to browse through them. Dr. Fodeh, the floor is yours. Thank you for being with us.
All right, thank you. So thank you so much for the introduction. I'm Samah Fodeh, Associate Professor and Director of the Data Mining Lab at Yale University. All right, so today I'm happy to discuss how AI can empower healthcare systems to make them more adaptive and data-driven, as well as resilient. To withstand not only healthcare's crisis, but also to evolve through innovation. Two aspects are very important, the resilience and innovation. So AI can help healthcare system be resilient by strengthening these systems to endure shocks, such as pandemics and natural disasters. And it also can advance innovation in healthcare systems by developing new models that are data-driven to better help us navigate the crisis. Next. So the question is, how can AI support healthcare? The answer to this question is in many ways, but within the scope of this conference, there are a few themes that were identified, including the advancement of public health systems and the innovation in telemedicine and digital health, as well as the development of predictive models and generating insights into the mental health challenges post-crisis. For the sake of time and in the context of this conference, I will be talking on the first two. However, I have, with the help of my team in the lab, explored a lot of interesting problems in the other two domains. So please don't hesitate to reach out if you want to learn more. Next. And also, as long as we are talking about healthcare systems and how AI supports healthcare systems, I will be explaining these two domains in the context of two main crises. The first is the unfortunate one that we all lived through and are familiar with, which is the COVID-19 crisis. The other one is the more elusive opioid crisis that we are facing here in the States, and I'm sure in many other communities. Next. All right, so on we go with the first domain, which is how AI can advance public health systems. Next. So this domain is all about how AI can modernize public health infrastructure to make it more to make it more resilient, and for us to better navigate the crisis. So there has been a lot of AI tools that were developed for this purpose, including dashboards and visualization tools, data integration platforms, and surveillance systems. So an example of the dashboards that were used is the Tableau public health system dashboards. And these tools give us an intuitive interface to better navigate and monitor the crises such as the COVID-19 crisis. Example of those are the ones used by the CDC and local governments to better navigate to better analyze the data and navigate the crisis. Also, we have the visualization tools. An example of that is the Power PI public health systems. And these systems were very popular during COVID-19, and as they can help us visualize the data more effectively. So the second set of tools where AI can help modernize public health infrastructure is the data integration platforms, and these platforms are very important for a unified look and monitoring of the crisis data, such as the COVID-19 crisis data. The third is the surveillance systems. And these surveillance systems were used by international agencies and governments for real-time tracking and monitoring of the outbreaks. And this helps with early detection of any signs of health-related outbreak. As you can see, the use of all these systems can provide us a more proactive and precise and timely public health decision-making. Next, please. Next. Yeah. So within the context of surveillance systems, I would like to share with you some of my work that I did in that space in the context of COVID-19. So we all know that social distancing was the primary mitigation strategy to bend the curve and stop the spread of the COVID-19 virus. But we also know that social distancing disrupted our lives in many ways. So many of us went to social media and social networks to express their thoughts and concerns about this social disruption that rocked our healthcare system and our lives in general. So I thought that tapping into this source of data, the social media data, can give us unfiltered look into the sentiment response of the public towards the social distancing measure. So I decided to use Twitter data to understand more about this public response to this harsh mitigation measure. So what I did, I designed a social distancing using Twitter data, where that measure consists of multiple facets. Each facet represents a certain behavior of the public towards the measure. Next, please. This is the framework of the study. So we downloaded Twitter data, as you can see here. And these tweets were geocoded to prepare them for special temporal analysis afterwards. As you can see, the social distancing facets that we developed include the purpose, implementation, adaptation, social disruption, and emotional response to this social distancing mitigation strategy. After we defined our measure, we did special temporal analysis for the first 3 months of the pandemic. Next, please. Go ahead. Here, I just give you the definition of the different facets as were designed. The first is the purpose. So what is the purpose of this very harsh mitigation strategy that was imposed on the public? And we tried to look into language in the tweets themselves that is indicative of slow the spread of COVID-19 and, perform social distancing, 6 feet apart, for example. The second facet is about the implementation. of the social distancing measure, which includes the closing of businesses, restaurants, schools, and colleges. So within our natural language processing tool that we use, the AI tool, we try to find dimensions of closing these activities around us. And then the third is social disruption. And this is about disrupting all the social activities, maintaining 6 feet apart, and canceling travels. So we try to look at language as well in the tweets, alluding of this particular concept. Adaptation. Adaptation is how people accepted their new way of life and started to conduct their daily activities virtually. And here I'm talking about online schooling, teleconferencing, online shopping, and telemedicine. So we try to capture this language and, different ways of saying these things are within the tweet. And finally, the emotional response to the social distancing strategy. And I started look into language of, how people feel about it. So emotional related conversation on Twitter, for example, like feeling alone or staying sleepy at home or even depressed. So these for us, compose the positive as well as the negative facets of the measure. Next, please. All right, so this is a snapshot of the surveillance tool that we sort of developed. It shows here the volume of the tweets in the first 3 months of the pandemic, as well as the spread across the US. Next, please. Next. This visual shows the US map for the first 3 months. And you can see on each map, there is a pie. The pie represents the social distancing measure, and each slice in the pie represents a certain facet. So for example, the red is a negative feeling, the blue is the implementation, the green is the adaptation. So looking at January, we see that there was limited presence of the pie, which corresponds to limited conversations about the social distancing, because in fact it was not yet there. But there was negative, as you can see here, the red occupies a larger portion of the slice, indicating that there is a negative conversation Twitter related to COVID-19. And the largest pies here correspond with the first locations where the COVID cases showed up in the US, Virginia, California, and Washington. If we look into February, we see that as new cases emerged from COVID-19, there are more and more pies on the graph, and we can see the blue portion, and I want you to focus on that one. I'm sorry, you can go back. The blue portion corresponds to the implementation facet, where people started really to close businesses, close restaurants, not going to school. So what we see here is a reflection of what people are doing on the ground. They're talking about it in social media. Now, going into March, there is more and more talking about the different facets of the measure. And it was very interesting for us to see how really social media mirrored what is happening on the ground. More cases in the US, as you can see here, more pies emerged, indicating that the social distancing measure was able to capture the different behaviors of the public towards the social distance strategy. And in particular, you see the green color, which corresponds to the adaptation. So people in March started really to conduct their shopping and work through teleconferencing online. So after we designed this social distancing measure with its facets, we linked that measure to the actual number of cases on the ground, because it was evident to us through this visualization. But we ran a linear mixed effect model where the outcome is the number of cases, and it was a monthly study over the 3 years. And the exposure was the different facets of the measure. And we adjusted for demographic, and found that there is a significant positive relationship between the social distancing measure using Twitter data and the number of cases. Next, please. So this study is an example that demonstrates for us how using AI through the surveillance or the dashboard that we developed can give us insights into what's happening on the ground. And this information would be taken by public health decision makers to better navigate the crisis by, for example, if we don't see implementation in one of the regions, the public health decision makers can compose or, run camps to better educate people about how to do social distancing and how it affects the spread of the virus. Next, please. Next. This is another study that I did in the context of COVID opioid crisis. And we also built a surveillance tool using Twitter data as well to better understand the culture behind the opioid addiction. So in 2024, there was 87,000 deaths in the US from an opioid overdose. And that's a large number. And also there was about 2.1 million who have opioid use disorder and diagnosed with opioid use disorder. With this study, I wanted to understand the culture behind opioid. And this study is really important for two reasons. The first is the use of social media data. And as you can imagine, relative to a closed room with a clinician or a healthcare provider, social networks provide an open and comfortable environment for individuals to share their thoughts and perspectives about matters that concern their health. For example, in this case, opioids. So I thought that this data is very rich for us to understand why people are heading towards that direction and start doing opioids. The second reason why this study is important is the use of AI and surveillance tools, because these tools can help us capture the signal of any emerging healthcare threat. In this case, it's opioid overdosing or opioid abuse before that signal hits the healthcare system. And the reason is that information travels faster over social network than in the formal channels of reporting within the health institution. So this what we did, we collected Twitter data and did the analysis using a text data analysis approach that depends on pre-trained language models. Please, the next slide. So this Twitter data that we downloaded, we used some search terms to identify the tweets that that talk about opioids. You can see here, for example, about 6,900 users spoke about perks, and these correspond to 7,600 tweets. This data was collected between April and May 2018. Next, please. So again, we wanted to understand the motives behind opioid addiction or abuse, let me say, because we can't determine really addiction on social network data. We can, measure the use, but the diagnosis is something different that clinicians can do. So we wanted to label those tweets based on the reason behind the abuse. Is it pain related? Like, are people abusing opioids because unintentionally, just because they want to relieve their pain? Or are they looking into using opioids for recreational purposes and to seek pleasure? And the third category is like put everything else in that category, which is like opioids are mentioned on Twitter for, advertisements or news related content, which we are not that interested in. Next. So with that in the back of our mind, we wanted to build a classification tool that if it looks at a tweet, it will label it with a mention of opioid. It will label the abuse if it's pain related or recreational related, and others. So we used machine learning and advanced deep learning methods, as well as pre-trained language models. You can see here random forest, SVM, support vector machines, BiLSTM, BERT large, and ExcelNet. These are the last two are pre-trained language models. And what we see here is the performance based on F1 score. The best model was the ExcelNet pre-trained language model. It gave us 0.92. F measure, and this is considered a strong performance and a good performance, considering that we are using with a very noisy source of data, such as the Twitter or social media data. Next, please. So this study is an example also of how AI helped us better understand the opioid abuse. And by teasing those causes or those motives behind the addiction or the abuse and differentiating whether it's pain related or recreational related. Okay, so these are like the two examples related to how AI can help with public health issues. Now, I want to talk about the second domain, which is innovations in telemedicine and digital health. Next, please. This domain is about promoting accessibility through the use of digital tools to connect healthcare with individuals who are remote or in low resource settings. They don't have access to health systems. So AI can help with different tools such as the mobile apps, telehealth visits, and messaging. So mobile apps were used a lot before COVID-19, but particularly for telehealth visits and messaging, the use of those increased tremendously during COVID-19. And the reason being that the social distancing that was imposed on the public. So with that social distancing in place, the health systems had to identify a new way of communicating with their patients. That's to maintain, continuity of care. We just saw the problem of the opioid crisis that happened during COVID-19 as well. And those with opioid issues were not able to come to the clinics to be seen and treated for their addiction and abuse. So you can imagine how the problems became bigger for people with other diseases. So telehealth visits was used tremendously and messaging, and it actually was able to bridge the gap between clinicians and patients who need them. Next, please. So this digital transformation of health systems not only provided reliable platform communication with the patients, but it also identified or created a new source of patient-generated data that we can use for better understanding healthcare delivery. With that, I want to focus on the patient portal for messaging. And this is my current research right now. It's funded by the NIH and PCORI, two health institutions in the US. And I wanted to understand the dynamics of health communication between the patients and providers. So this patient portal is considered very precious because it provides accessibility to care. Anyone who is in the healthcare system can access the patient portal and communicate with their providers. The second thing is that this data, that when the patients start writing about their message needs to the doctors, it's very rich. Like the patients share their wants, their needs, their feelings, their preferences, their goals of care, as well as their social barriers. And that by itself is a big thing in healthcare. Can you please move on? So knowing that communication affects patients' outcomes, negatively if the communication is poor, and positively, of course, if it's going the right direction. But in this study, I wanted to characterize the patient-provider dynamics using the messages in the patient portal. And I used large language models to do that. Next slide, please. So when I say characterizing the patient-provider communication, I'm talking about different aspects of communication. And these corresponds to, for example, information giving, where the patient share with the doctor information about their symptoms or the side effects that came up based on a certain medication. Information seeking, maybe the provider is asking the patient about progress in their adherence, for example. Or even the patient can seek information from the doctor about their lab results or their imaging results. The other very important component of patient-provider communication is partnership. Is there active collaboration between patients and providers? That's what we want to understand, because the push right now is for patients to be contributing to their plan of care. And also shared decision-making is very, very important to see if the patient has a say. Do they contribute in the decision that's being made about their treatment plan? And the last one is the empathy. That's particularly to study the response of the provider towards their patients. Are sympathizing with their patients? Are they disregarding their emotions or being nice to them and, very responsive when the patients are emotionally weak? Next, please. So we downloaded some data from the Yale New Haven Hospital patient portal. We had about 750 messages, and we splitted those messages into sentences, about 2,000 sentences. We manually read those messages and started to label each message with the corresponding aspect or code that it's information giving or seeking or whatever. So we identified two tasks that we wanted to do. The first is the labeling of a sentence with the appropriate communication code. The second is extracting the particular phrase that is indicative of that particular code. Next, please. All right, so as I said, we use large language models, and these are models that are trained, AI models that are trained to understand the human language and generate the human language. Examples like the ChatGPT and all these platforms that are being used for this purpose. We tried with different sizes of large language models. There are small, medium, and large, and we fine-tuned some of the smaller models. Next. Our results show, with the context of classifying the sentences relative to the codes or aspects that are present in them, showed that the fine-tuned Llama model, which is a smaller one, the 8 billion parameter, gave us 0.73 F1 score. And in terms of evidence extraction, it gave 0.89 F1 score. This is good results for a benchmark. And right now in the lab, we're working on improving those results. But it was very interesting for us to see how large language models was able to identify these different codes of communication. So next. So, with that, this is another example where we see that innovation in healthcare systems using AI can help us, even us be innovative and try to better the system by understanding, for example, in this case, the communication between patients and providers. So the last conclusion of the system of my talk is that AI is a catalyst that actually can turn crises into opportunities in order to build better and stronger systems. Thank you so much, and I apologize for the confusion about the slides. And please, if you are interested to learn more about the other two domains, reach out. Thank you.
Thank you so much, Dr. Fodeh. Thank you.